Hello students, welcome to this session. Let's study endocrine system. So now to begin with the types of glands, there are two types of glands, exocrine glands and endocrine glands. The exocrine gland, the gland which releases its secretion into duct and then it is carried to the organs, it is called as exocrine gland. Endocrine gland or ductless glands, the gland which do not have ducts and discharge its secretion directly into the blood, are called as endocrine or ductless glands, and the secretion of endocrine or ductless gland is called as the hormone. Properties of hormone. The hormones are non-nutrient chemicals which act as intercellular messengers and are produced in trace amounts. So they are secreted in small amount by ductless glands. The hormones are released directly into the bloodstream and therefore they can reach any part of the body, and they are directly released in blood and are carried to target organ where their effect is seen. They are specific in action, they act only on target organ. Now we will see classification of hormones. So there are two types, lipid soluble and water soluble. So in lipid soluble, the first type is steroid and the examples are cortisol, testosterone, estrogen, progesterone, aldosterone. Then second type is iodothyronine and the examples are T3, T4. In water soluble, the first type is amino acid and the examples are epinephrine, norepinephrine, dopamine, melatonin. Second type is peptide hormone. So examples are oxytocin, vasopressin. Then third type is protein, so protein hormone. So the examples are insulin, glucagon, growth hormone. Then next type is glycoprotein hormone. So examples are TSH, LH, that is luteinizing hormone. Then the next type is eicosanoid hormone. It is prepared from the arachidonic acid and the examples are prostaglandins, leukotrienes. So mechanism of hormone action. So hormone, it reacts with the target tissue. So on that the hormone receptors are present. They are protein in nature and the types of hormone receptors are three. So one is membrane bound receptor. So it has the second messengers like CAMP, cyclic adenomonophosphate, and then calcium. Then intracellular receptors, they perform chromosome function. Nuclear receptors, they perform the function of gene expression. Then hormone receptor complex is formed and then it gives biochemical changes in the target tissue. So it releases second messengers like CAMP or calcium, and then physiological or developmental effects are seen. Now we will see endocrine glands. So there are total around 11 endocrine glands. So the most important the gland is hypothalamus. Then second master endocrine gland is pituitary gland. Then pineal gland, thyroid gland, parathyroid gland, thymus, pancreas, adrenal gland. It is also called as suprarenal gland. Then testes and ovaries, and then other glands, tissue like heart, kidney, and gastrointestinal tract. Now we will see all the glands in detail. So first is hypothalamus. So it is real master gland. It controls the secretion of the anterior pituitary gland. That is why it is called as real master gland. It is located in the forebrain, that is basal part of the diencephalon. The structure is, it has neurosecretory cells related to the anterior pituitary gland and neural regulation related to the posterior pituitary gland. The hormones secreted by hypothalamus, they are of two types, releasing hormones and inhibiting hormones. So releasing hormones, so they stimulate production of hormones from the anterior pituitary gland. So that is growth hormone releasing hormone, thyroxine releasing hormone, gonadotropin releasing hormone, prolactin releasing hormone, corticotropin releasing hormone, antidiuretic hormone. And then inhibiting hormones, they inhibit secretion of the hormones. So they are growth hormone inhibiting hormone, also called as somatostatin. So it inhibits release of growth hormone. Then prolactin inhibiting hormone. So these are the hormones secreted by the hypothalamus. So these are the list of hormones secreted by hypothalamus. So first is thyrotropin releasing hormone. So it stimulates thyroid stimulating hormone releasing from the anterior pituitary gland. Then prolactin releasing hormone. So it stimulates prolactin release from the anterior pituitary. Corticotropin releasing hormone. So it stimulates adrenocorticotropic hormone ACTH from the anterior pituitary. growth hormone releasing hormone, so stimulate growth hormone release from the anterior pituitary. Gonadotropin releasing hormone, so stimulate FSH and LH release from the anterior pituitary. Stomatostatin, so it is growth hormone inhibiting hormone, so it inhibit growth hormone release from the anterior pituitary. Dopamine, so it is prolactin inhibiting hormone, so it is inhibiting prolactin release from the anterior pituitary. So hypothalamus has three portions. Anterior, so the function of anterior portion is circadian rhythm, thermoregulation and sweating. The middle portion related to the blood pressure control, heart rate and GI functions. Posterior portion related to the sleep, memory and learning. Now second gland is the pituitary gland. So it is situated in the brain on the floor of the cranium, and it is the size of pea, and it lies in the sphenoid bone sella turcica of the skull attached to the hypothalamus by stalk. It is called as master endocrine gland because it controls the secretion of all other endocrine glands. The structure of anterior pituitary gland, it consists of two main lobes, so anterior lobe and posterior lobe. Anterior lobe also called as pars anterior or adenohypophysis. It has two parts, pars distalis and pars intermedia. Posterior lobe also called as pars nervosa, or it is also called as neurohypophysis. Now we will see hormones of the pituitary gland. So anterior pituitary gland, it has two parts, pars distalis and pars intermedia. So pars distalis has the 6 hormone secretion. So first is growth hormone. It promotes growth of the whole body. TSH, thyroid stimulating hormone, also called as thyrotropin. It stimulates thyroid gland to produce T3 and T4. ACTH, adrenocorticotropic hormone, also called as corticotropin, so it stimulates adrenal gland to produce hormones. Gonadotropin, ovaries and testes. FSH, follicle stimulating hormone. Then fifth is the LH, luteinizing hormone, or ICSH, interstitial cell stimulating hormone, and sixth is a prolactin. The hormone secreted by pars intermedia is MSH, melanocyte stimulating hormone, so that melanin regulate pigmentation of the skin. Posterior pituitary gland, it has neurosecretion secreted by hypothalamus and stored in the posterior pituitary. So there are two, ADH and oxytocin. So ADH also called as, that is antidiuretic hormone, vasopressin, and then it is having function over the kidney for the water absorption. Then oxytocin, it has a function on the smooth muscles, that is uterine contraction in labor or milk ejection. Third gland is the pineal gland. So it is located in the forebrain, and the hormone secreted by pineal gland is melatonin. The function of melatonin is regulation of 24-hour, that is diurnal rhythm of the body, that is biological clock. Then it is also related to the metabolism, pigmentation, menstrual cycle, defense, sleep, normal body temperature. The fourth gland is thyroid gland. It is a pair of thyroid gland located in the neck just below the larynx or Adam's apple, and it consists of two lobes, that is they are lying on either side of the trachea and they are joined by the isthmus. The structure of thyroid gland, so it is composed of many thyroid follicles and the stroma. So thyroid follicles consist of follicular cells which secrete T3 and T4, and the in between the cells present, they are also called as parafollicular cells or C cells, and they secrete calcitonin. So thyroid gland regulation, so hypothalamus secretes thyrotropin releasing hormone which stimulate anterior pituitary gland to secrete TSH, that is thyroid stimulating hormone. Then it stimulates thyroid gland to produce or secrete T3 and T4, triiodothyronine or tetraiodothyronine. Functions of thyroid hormones, so T3 and T4, that is thyroxine. So the functions are basal metabolic rate regulation, RBC formation, metabolism of carbohydrate, proteins, lipids, water, electrolytes, regulation of the menstrual cycle, and then CNS, that is central nervous system development in the childhood age. And then the second hormone that is secreted by the parafollicular cells is thyrocalcitonin, which regulates the blood calcium level. Fifth gland is the parathyroid gland. They are 4 in number and they located in the each pair at the back side of the thyroid gland. The hormone secreted by parathyroid gland is parathormone or PTH, and it is regulation for the calcium ions. The functions of the parathormone, they are acting as a hypercalcemic hormone. So it increases calcium level in the blood by bone demineralization, increase calcium reabsorption in renal tubules, and increase calcium from the digestion. Now the sixth gland is the thymus gland. It is located between lungs behind sternum, and the function, it is development of immune system, and the hormone secreted by thymus is thymosin, which helps T lymphocytes, that means cell mediated immunity and antibody mediated immunity. And in older people, if the thymosin is less, then they have less immune response. Hello students, welcome to this session. Let's study endocrine system. Seventh gland is the pancreas. So it is leaf-shaped lobulated gland present in the C-shaped loop of the duodenum. It has 4 parts: head, neck, body and tail. And the exocrine portion, that is pancreatic duct, opens into the duodenum along with the bile duct. The functions of the pancreatic gland, so it is a mixed gland, that means it has both functions, endocrine and exocrine. So exocrine part, they are acini, which secrete pancreatic juice, which is required for the digestion of the proteins mainly, and then it is carried, that is through the pancreatic duct, and which opens into the duodenum. Then endocrine part is called as the islets of the Langerhans. So it has 3-4 types of cells, like alpha cells which secrete glucagon. So it is a hyperglycemic hormone because of the gluconeogenesis. Beta cells secrete insulin which control blood sugar level. So it is hypoglycemic hormone by the glycogenesis. Delta cells which secrete somatostatin, and PP cells secrete pancreatic polypeptide. The glucagon, that is secreted from the alpha cells, so they act on the hepatocytes, and it is a hyperglycemic hormone. So by the mechanism, increases sugar, like mechanism glycogenolysis, gluconeogenesis, and it reduces cellular glucose utilization, and in this way it increases the blood sugar. And then insulin secreted from the beta cells of the Langerhans, so it acts over the hepatocytes and adipocytes, that is fat cells, and it is a hypoglycemic hormone. So the mechanism is glycogenesis, that is conversion of glucose into the glycogen. Then it inhibits gluconeogenesis, and it increases cellular glucose utilization, and in this way it decreases the blood sugar in the blood. Eighth gland is the adrenal gland. So it is located in the above portion of the kidney and also called as suprarenal gland. So it is a triangular gland, each present over the superior surface of the kidney, and it has 2 parts, medulla and cortex. So cortex is the outside portion and medulla is the inner portion. So structure of the adrenal gland, so it has 2 parts, outer cortex and inner medulla. So cortex is a yellowish tissue surrounding the medulla, and it is stimulated by the pituitary hormone, that is ACTH, adrenocorticotropic hormone, to produce the adrenal gland hormones. So the layers of the cortex are 3, that is outer layer is also called as zona glomerulosa, middle layer is zona fasciculata, and innermost layer is the zona reticularis. And then they secrete the adrenal gland hormones, also called as corticosteroid hormones. The medulla, it is a grey core of the gland. It consists mainly of the chromaffin tissue, and it's stimulated by the sympathetic nervous system to produce hormones like epinephrine and norepinephrine, that is adrenaline and noradrenaline. So adrenal gland hormones, so the outer cortex, it has 3 layers. So outermost layer, that is zona glomerulosa, it secretes mineralocorticoids, that is aldosterone, and it helps in regulation of the minerals like sodium and potassium by the kidney, and excretion of the potassium and phosphate, and electrolyte balance, fluid balance, blood pressure control, and osmotic pressure control. Then zona fasciculata, it secretes glucocorticoid, that is cortisol or cortisone. And then it helps in the carbohydrate metabolism, that is glucose metabolism, inhibits cellular uptake and utilization of the amino acids. It is anti-inflammatory reaction and suppresses immune response and stimulates RBC production. Then the third layer is zona reticularis. So it secretes androgen and it is mainly for the sexual characteristics, that is masculinization. Then adrenal medulla, it secretes the medullary hormone, that is catecholamines. So adrenaline, also called as epinephrine. So it has a function like increase heart rate. So it has a function for the fear, fight and flight. So increase heart rate, increase force of constriction of the heart, dilatation of coronary vessels and blood vessels supplied to skeletal muscles, pupillary dilatation, sweating, increase respiratory rate, breakdown of the glycogen and lipids and proteins. So these are the hormones secreted by adrenal medulla, that is adrenaline and non-adrenaline. So non-adrenaline stimulates sympathetic autonomous nervous system. So 9 gland is the testis, which is present in the males. So there are paired oval testes lie outside the abdominal cavity, that is it is present in the covered skin sac, that is called as scrotum. And the structure of the testis, so each testis contains many tubules, they are called as seminiferous tubules. In that the function is the spermatogenesis. Between seminiferous tubules there are numerous interstitial cells, also called as Leydig cells, which produce a male hormone, that is testosterone. And the in between cells are there, they are also called as Sertoli cells or nursing cells, which inhibit the FSH, that is follicle stimulating hormone. Function of testes, so there are two. One is production of sperms from the spermatogenesis, and second is the production of male sex hormone, that is testosterone. And the testosterone is required for the regulation of the development of male reproductive system organs, that is epididymis, vas deferens, seminal vesicle, prostate. And it forms male secondary characteristics such as the deep voice, male hair distribution, typical distribution of fat, and then third function for the spermatogenesis. 10th type of gland is the ovary, which is seen in females. So 2 ovaries are there, located below and behind the uterine tubes. And the structure, it contains ovarian follicles, primary, secondary, tertiary, that is mature follicle, and which secrete hormone, that is estrogen. And the corpus luteum, it is the ruptured part of the follicle after ovulation, that is release of ovum, and then it secrete progesterone. So functions of ovary, so there are two: production of eggs or ova, also called as oogenesis, and the production of female sex hormones, that is estrogen and progesterone. And the estrogen is mainly required for the development of female sex organs and mammary glands, and development of ovarian follicles and female sexual characteristics like voice, build, short height. And then progesterone, it helps in the pregnancy and milk production from the mammary glands. Endocrine cells are also seen in heart, kidney and gastrointestinal tract. So in heart, in the arterial wall of the heart, the hormone is ANF, that is atrial natriuretic factor, which is required for the dilatation of the blood vessels and decrease blood pressure. Then in kidney, juxtaglomerular cells are there, which secrete hormone, that is erythropoietin, which is required for the erythropoiesis, that is production of RBCs. And calcitriol, that is vitamin D, which is required for the calcium absorption. Renin, angiotensinogen, which is required for, is converted into the angiotensin 1, and then it regulates blood pressure. Then gastrointestinal tract, so there are few hormones like gastrin, so it is G cells of the stomach, so gastric glands, parietal cells, and it secrete HCl and pepsinogen. Then secretin, they are S cells of the duodenum. Then they stimulate pancreas, and then water and bicarbonate inhibit intestinal motility and gastric acid. Cholecystokinin, eye cells in the duodenum, so pancreas, pancreatic enzymes, amylase and lipase, and gallbladder, bile juice. Gastrin inhibiting peptide, they are K cells of the duodenum, inhibit gastric secretion and the motility. So this is a summary of hormones and functions of the hormones secreted from the endocrine glands like pituitary, thyroid, parathyroid gland, adrenal gland, pancreas, ovary and testes. Hello students, let's study endocrine system part 2, that is applied endocrinology. Now we will see few clinical cases and then in the end of this session you can give the answer. So first case, a patient with complaint of dryness of eyes and bulging of eyes, dryness of skin and sometimes shaking of hands. He also give history of weight loss and heat intolerance, that is he could not tolerate the heat. So what could be the clinical diagnosis? Second case, a mother noticed that her child at age of 3 months not giving social smile and at age of 6 months not crawling. She also gave history of bulky tongue and mouth is always open. So what could be the clinical diagnosis? The first gland is pituitary gland. So the first hormone of the pituitary, anterior pituitary gland, is growth hormone. So deficiency of growth hormone in childhood causes stunted growth or dwarfism. So in that the patient will have all the limbs are short in length, that is upper limb and lower limb short in length, and the height of the person is less short. Increased growth hormone in childhood causes abnormal growth of body, and that is called as giantism. So in that person will have very large hands and feet, thick toes and fingers, a prominent jaw and forehead, coarse facial features. Children with giantism may also have flat nose and large heads, lips and tongues. Headaches, vision problem and excessive sweating is there, and then severe and recurrent headaches, weakness is there. Insomnia and other sleep disorders may be there. There will be delayed puberty in both boys and girls, and irregular menstrual periods in girls, and maybe deafness is also there. Increased growth hormone in adult causes disfigurement of face, and it is called as acromegaly. The symptoms in adults are acromegaly affects bones and then tissues and causes them to grow in irregular way. So there will be enlarged hands and feet, changes of face shape including more prominent jaw and forehead, increase in size of lips, nose and tongue, excessive sweating or oily skin, deepening of voice, headache, joint pain, vision changes, increase in number of skin tags, numbness in hands, sleep apnea are the symptoms present in acromegaly. Posterior pituitary gland hormone is ADH, that is antidiuretic hormone, also called as vasopressin. So deficiency of ADH causes diabetes insipidus. So in that the decreased water conservation, that is because of the diuresis, that is polyuria. So increased urination, that is called as diuresis, and because of that there will be water loss and there will be dehydration in that patient. Second gland is the thyroid gland, and in that disorder the first is goiter. So goiter is abnormal enlargement of the thyroid gland, and it is butterfly shaped gland located at the base of the neck just below the Adam's apple. So causes for the goiter can be iodine deficiency or autoimmune diseases like Graves' disease or Hashimoto's thyroiditis, hyperthyroidism or hypothyroidism. Then the symptoms are usually goiters are painless, but large goiter may cause cough and difficult to swallow or breathe because of the pressure effect. And the investigations are done, that is thyroid function test, to investigate the effect and cause of the goiter. Hypothyroidism, it is deficiency of thyroid hormones, that is low T3 and T4, and it is because of the mainly iodine deficiency. And the causes are genetic defect in the thyroid development, post surgery, radioiodine therapy or external radiation, autoimmune thyroidism, Hashimoto's thyroiditis or iodine deficiency. And the symptoms are the enlargement of the thyroid gland, then abnormal weight gain, low metabolic activity, Then you can see in this picture dryness of the skin, high cholesterol level, poor concentration and memory, muscle weakness, and generalized fatigue and unexplained weight gain. And the investigations done are T3 T4 decreased and TSH increased. The hypothyroidism in adults is called as myxedema, and hypothyroidism in infants is called as cretinism, and these two conditions we will see in detail in the coming slides. Cretinism, it is also because of the hypothyroidism in the infancy or early childhood. So the term cretin meaning Christian or Christ-like, so it is applied to those who are unfortunates and they are so mentally retarded, so they are incapable of sinning. The cause is the severity of the mental impairment related to the time at which the thyroid deficiency occurs in utero. So normally T3 T4 crosses placenta and it is required for the fetal brain development. If there is maternal thyroid deficiency before the development of fetal thyroid gland, the mental retardation is severe. Clinically, there is big swollen protruded tongue, mouth is always open, low mental and physical activity, impaired development of skeletal and central nervous system. Because of that, there is mental retardation, short stature, coarse facial features and umbilical hernia. And investigation of thyroid function test, T3 T4 are decreased and TSH, that is thyroid stimulating hormone, is increased. Myxedema, so it is hypothyroidism developed in the older child or the adult. Clinically, myxedema is marked by slowing of the physical and mental activity, generalized fatigue, apathy, mental sluggishness, and which may resemble to the depression. Speech and intellectual functions are slowed and they are listless, cold intolerant, so they cannot tolerate cold. Frequently they are overweight, constipation and decreased sweating is there, skin is cool and pale because of the decreased blood flow, reduced cardiac output, and because of that shortness of the breath and decreased exercise capacity, broadening and coarsening of the facial features, enlargement of the tongue, deepening of the voice, tiredness, heavy menstrual bleeding in female, hair loss and slow heart rate. And then investigations of the thyroid function test, T3 T4 are decreased and TSH is increased. Hyperthyroidism, it is increased secretion of thyroid hormones. It is mostly because of the hyperfunction of the thyroid gland. And thyrotoxicosis is hypermetabolic state of the elevated levels of the T3 and T4. The causes of the hyperthyroidism: diffuse hyperplasia, also called as Graves' disease, or toxic multinodular goiter, toxic adenoma, iodine-induced hyperthyroidism, or neonatal thyrotoxicosis because of the maternal Graves' disease. And the symptoms are enlargement of the thyroid gland, weight loss, nervousness, fatigability, excessive sweating, increased body temperature, heart rate is increased, tremors, that is shaking of the hands, protrusion of eyeball, also called as exophthalmos, and because of that the eye is open and sometimes eye may become dry. And the investigations, T3 T4 are increased and TSH is decreased. Graves' disease, it is most common cause of hyperthyroidism, characterized by triad of the thyrotoxicosis, ophthalmopathy, that is exophthalmos, and dermopathy. The Graves' disease is an autoimmune disorder caused by the activation of thyroid epithelial cells by autoantibodies to the thyroid TSH receptor. The thyroid in Graves' disease is characterized by diffuse hypertrophy and hyperplasia of the follicles and lymphoid infiltrates. Investigations done, so in that elevation of the T3 and T4 and TRAB, that is thyroid receptor antibody test, is positive. So to differentiate hyperthyroidism and hypothyroidism, so in hyperthyroidism patient is having anxiety, in hypo depression, in hyper patient is restlessness, in hypo patient is having fatigue, in hyper tachycardia, hypo bradycardia, that is slow pulse rate, in hyper weight loss, in hypo it is weight gain, hyper thinning of the skin, in hypo it is dry itchy skin, in hyper heat intolerance, that is heat is not tolerated, and in hypo cold intolerance, that is cold is not tolerated. in hyper, frequent bowel movement, in hypo, constipation. In hyper, goiter may be possible, in hypo, goiter is there. In hyper, the low TSH, in hypo, high TSH. In hyper, the T3 T4 are increased, and in hypo, T3 T4 are decreased. Indications of the thyroid function test: patient with history of sudden weight gain, sudden weight loss, heat intolerance, cold intolerance, history of infertility, long-term constipation or diarrhea, delayed development in the baby, goiter, that is thyroid gland enlargement, exophthalmos, that is enlargement of the eyeballs, tremors, that is shaking of the hands. The thyroid function tests are the group of investigation done to diagnose the thyroid gland disease. In panel 1, we can do serum T3, serum T4 and serum TSH, that is thyroid stimulating hormone. And then in panel 2, it is free T3, free T4, ultra sensitive TSH. And for the autoimmune thyroid disorder, thyroid peroxidase antibody and TRAB, that is thyroid TSH receptor antibody. Then ultrasound or thyroid scan or MRI of the thyroid gland can be done, and fine needle aspiration, cytology or biopsy can be done. The clinically, if T3, T4, TSH are normal, then it is called as euthyroidism. If T3, T4 decreased and TSH is high, it is called as hypothyroidism. And T3, T4 increase and low TSH, it is seen in hyperthyroidism. Hello students, let's study endocrine system part 2, that is applied endocrinology. Pancreas, the insulin is produced by pancreas, and the deficiency of insulin causes diabetes mellitus. So diabetes mellitus is a group of metabolic disease in which there are high blood sugar levels over a prolonged period. So diabetes is due to either pancreas not producing enough insulin or the cells of the body not responding properly to the insulin produced. So the classification of diabetes mellitus, the types are type 1 diabetes mellitus, type 2 diabetes mellitus and gestational diabetes. That means the diabetes is seen only in the pregnancy. Now we will see role of insulin. So insulin usually balances blood sugar level in the body. So how it happens? So it inhibits the breakdown of glycogen, that is glycogenolysis. It inhibits the process of gluconeogenesis, that is production of glucose from other non-carbohydrate sources like fats and proteins. It stimulates the transport of glucose into muscle cells. Then it stimulates the storage of glucose in form of glycogen, that is glycogenesis. So in this way, insulin helps to balance the blood sugar level in the blood. Now we will see types of diabetes mellitus. So there are two mainly, type 1 diabetes and type 2 diabetes. So type 1 diabetes, it results from the pancreas failure to produce enough insulin, and it was previously called as insulin dependent diabetes mellitus or juvenile diabetes because it is seen in mainly children. And type 1 diabetes mellitus is characterized by loss of insulin producing beta cells of the islets of Langerhans in pancreas, and which give rise to insulin deficiency. Type 2 diabetes is insulin resistance, a condition in which cells fail to respond to insulin properly. So this form previously called as non-insulin dependent diabetes mellitus or adult onset diabetes. The most common cause of the type 2 diabetes is in adults because of the excessive body weight and not enough exercise. So obesity, which is body mass index more than 30, lack of physical activity, poor diet, stress and urbanization. And dietary factors like consumption of sugar or sweet drinks in excess or fat. So saturated fats and trans fatty acids increases the risk, and polyunsaturated and monounsaturated fat decreases the risk of diabetes. Eating lots of white rice also increases the risk of diabetes mellitus, that is type 2. In diabetes mellitus, the patient gives symptoms of polyphagia, that is increased craving for the food, then polydipsia, that is increased thirst for the water, and polyuria, so increased frequency of the urination. And patient also gets the symptoms of weakness, tingling and numbness in the limbs. And if the diabetes is not controlled, then complications of diabetes may be neuropathy, that is involvement of the nerves, then retinopathy, involvement of the eyes, nephropathy, involvement of the kidneys, then heart. So there can be atherosclerosis or myocardial infarction, and then because of the accumulation of the ketones, patient may get diabetic ketoacidosis or diabetic coma. So these are the complications of the uncontrolled diabetes. For diagnosis of diabetes mellitus, following investigations can be done. So first, fasting plasma glucose level, that is without taking anything, we can take blood and urine, and if blood level is more than 126 milligram deciliter for the glucose, then postprandial, that is after meal, lunch, the plasma glucose level, if it is more than 200 milligram percent, or GTT, that is glucose tolerance test. So 2 hours after 75 gram oral glucose load, that is glucose tolerance test. The symptoms of the high blood sugar and casual plasma glucose more than 200 milligram, or glycosylated hemoglobin, that is HbA1c, if it is more than 6.5%. So any of the criteria can diagnose the diabetes mellitus. The prevention of diabetes mellitus. So first, to maintain the body weight, engaging in the physical exercise, consuming healthful diet, maintaining diet rich in whole grains and fiber and good fats. Smoking should be stopped. Control of blood pressure, maintaining proper food care are important, because diabetic foot ulcers common complication of the diabetes. So proper foot care and proper wound healing is required for the prevention of the complications. Adrenal gland. So first is the Addison disease. So this Addison disease is a syndrome in which it is due to the inadequate secretion of corticosteroid hormones and aldosterone by adrenal glands. So patient gets the symptoms of weakness, loss of energy, low blood pressure, dark pigmentation of the skin and irritability or low mood. Then the disease is curable by replacement of the hormone therapy. Adrenal gland. So oversecretion of the corticosteroid hormone by adrenal gland causes Cushing's syndrome, and it is because of the overstimulation of the adrenal glands by excessive amount of hormone, that is ACTH. So ACTH oversecretion, if it is because of the tumor of the pituitary gland, it is called as Cushing's disease, or it may be because of the malignant tumor in the lung or elsewhere. The symptoms of the Cushing's syndrome: rapid weight gain, moodiness, irritability, depression, muscle bone weakness, memory and attention dysfunction, osteoporosis, diabetes mellitus, hypertension, sleep disturbances, menstrual disorders in females like amenorrhea or infertility. In men, it may be impotence, hirsutism, baldness. Hirsutism means abnormal or excessive hair growth pattern at the abnormal sites, and baldness means no growth of the hair. So to summarize applied endocrinology, pituitary gland produces growth hormone. The decreased level causes dwarfism or stunted growth, and increased level in the childhood causes giantism. In adult, it causes acromegaly, and the deficiency of ADH causes diabetes insipidus. Pineal gland secretes the melatonin. Thyroid gland hormone T3 and T4. Deficiency causes hypothyroidism. In infancy, it causes cretinism. In adults, it causes myxedema. And increased level of T3 T4 causes hyperthyroidism. And autoimmune disorder, the toxic level causes thyrotoxicosis or Graves' disease. The second hormone secreted by thyroid gland is calcitonin. Parathyroid gland secretes parathormone, and decreased level causes hypocalcemia. Increased level of parathormone causes hypercalcemia. Thymus, the hormone is thymosin. Pancreas, the first hormone is insulin, so decreased level causes diabetes mellitus. The second hormone is glucagon. Adrenal gland, also called as suprarenal gland. So adrenal cortex secretes aldosterone, cortisol and androgen. The decreased level of corticoid hormones causes Addison's disease, and increased level of the corticoid hormones causes Cushing's syndrome. Medulla secretes epinephrine and norepinephrine. Testes, the hormone is testosterone. Ovary, the hormone is estrogen and progesterone. So now with detailed knowledge of the applied endocrinology, now we can give the clinical diagnosis. For the first case is Graves' disease, and for the second case it is cretinism. Hope you find this session useful for your understanding and for your exams. Thank you.